Good evening. Tonight I'm going to speak about something that I've been involved with for about 2 years, which is creating this sustainable structure for computer science students, actually here at Ben Gurion University, to build medical information systems. And before everybody falls asleep on me, I can't imagine there's a ton of informatics nerds in the room. I think it's actually a relevant discussion for 2 reasons. One, I'm going to talk a lot about open source technology, and there has been for many years and continues to be sort of this open source revolution happening. And 2, I think it's a great little case study to talk about how it is that students, medical students, engineering students, whatever kind of students, can really become involved and make meaningful change. And so the high level, and we'll come back to this picture, is that I put together a group of Ben Gurion students, me being one of them, others coming from the other side of Ben Gurion here and over in the information systems department, OpenMRS, which is an open source electronic medical record software, and then the Refugee Clinic up in Tel Aviv. And so there's been this really great sort of symbiotic relationship between everybody where everyone's benefiting, everybody's gaining, and we've managed to do some cool stuff. So before we get there, you're going to have to get a bit of a history lesson. And we're going to go back probably around the mid-90s, and this is what the web looked like. This is Wikipedia rendered in Lynx, which was the web browser that I started using when I was young and still just as nerdy. So that quickly changed and became Mosaic, and Mosaic quickly became Netscape, and then Netscape quickly became Firefox. And what's important about this is that Firefox is open source. Basically, Netscape said, we're going to release our source code to the world and let the world improve it. And what this means is that somebody in India who said, well, I'd really like my web browser to do this new function, they could suddenly add it. And all over the world, you suddenly had thousands and thousands of contributors that created, which by 2010 was basically the browser that was using 30%, that was providing 30% of the web browsing to the entire world. That's decreased because of Chrome. But it became the most powerful browser probably in the world. And it was created by computer nerds at night in their homes who were saying, oh, I'd really like it to do this or this or this or this. And in fact, soon after Mozilla opened up their source code, this is an email from, obviously not to me, but an email from Steve Case, who was then the founder and CEO of AOL. And he basically said, we certainly realize that platform innovation comes from the work of thousands of passionate developers. And we share with you our view that the agenda of Mozilla is and should be set by those who contribute to it. He then goes on to say that basically it's larger than Netscape, and it's larger than the company of AOL at the time. And so there were thousands and thousands of people who were contributing to this thing, and it was a new concept and a new revolution. And to this day, you could still, if you're a computer coder, you could still go online and you could still contribute to Mozilla, which creates Firefox. And if you're not a coder, there's certainly other opportunities to contribute, whether it's just localization. If you know a language, you could translate Firefox into that language. You could write documentation. You could help other users by answering questions if you're a more advanced user. But it's changed this paradigm from where you have Microsoft, who's providing Windows and Word and sells it to you, and you get it in a shrink-wrap package, to open source. So you have access to everything, you can change everything, and you can work with everything. And this was sort of outlined in this really great book called The Cathedral and the Bazaar, and he talks about this open source revolution by Eric Raymond. And the Bazaar is his description of open source, where you have all of these programmers who open up their code and make it available over the internet, and then people take and use, improve, and whatever. And the reason this is relevant at all is OpenMRS. And so OpenMRS is, like I said, a medical information system, electronic medical record system. And what that means is it's the place where your doctor puts all of their patient's information into that. And so we've used these in Israel. It's OFAC, it's Chameleon in the States. The big one is Epic. We have Cerner, Allscripts. Well, OpenMRS came about from a different place. OpenMRS project started actually in Kenya at AMPAC. And it was a project between Indiana University. Now, people might know why I'm excited to be going to Indiana University next year, and Greensweig Institute. And basically, they realized that they were taking care of HIV patients who it was essential to have really great great continuing care, essential to have follow-up, and essential to get great data out of the population. And so a group of physicians and informaticians created OpenMRS. And when they did that, they said, we're only a few people, why don't we open this up to the world and make it open source? You know, we have no reason to make money on this, we just want it to benefit as many people as possible. And so many other organizations got involved and started using the software and improving the software. And every time Partners in Health made an improvement, well, AMPATH got that. And then Millennium Villages Project jumped in, the CDC, the World Health Organization. And today, there are implementations of OpenMRS all around the world. This is probably an outdated map or an incomplete map, but I think the most significant about this, and I guess you really can't tell it from this map, is that most of the contribution to this open source project is actually coming from the Global South. The governments of Rwanda, Kenya, parts of India have all adopted OpenMRS and are the ones who make these innovations and these improvements, which they then supply back to the Global South. And so there's a dot here, and that's actually the Tel Aviv Refugee Clinic, where we're using it. And I think before we jump into talking specifically about the program and what we've been doing here, one more kind of important part of the whole open source thing. And that's how is it that you organize people literally from all over the world to work together. And there are, I've worked personally with people everywhere from Vietnam, Australia, all over Central Africa, you name it, we've worked together on OpenMRS projects. So how does that actually happen? What's the anatomy of that? So this is one afternoon of my email box. And these are mailing lists, and people are talking about different issues with OpenMRS, everything from versioning to question and answer sessions to errors with the standalone version. There's also a chat room, and yes, people still use chat rooms. And this is IRC, and there are conversations happening around the clock in there. If you need help, you can sign in and get help from really experienced developers on the platform. There's also a wiki. The whole idea of a wiki is that anybody can get in there, edit it, work on it, and then provide information. And so there's a pretty comprehensive knowledge base that anybody can access at any hour of the day who's thinking about downloading for free and using OpenMRS. And all that tech stuff is great. There really is no replacement for face-to-face meetings. We get together once a year. This one in the Philippines. We do it in countries or in places where there's active implementation of OpenMRS. And this year, Philippines had just opened up 105 new sites for their public health system. And an OpenMRS conference is very different than your average academic conference, which is sort of a snooze fest, in my opinion. These are very active. It's an open conference. Everybody plans their schedule on the day that you arrive there by putting up little stickies on the wall and having fights with people about what's important to talk to and what's not important to talk about. And then presenting your work, what you've been working on, and it's a really big networking event basically, and everyone's hearing from everyone. And so this is getting now to the project that I've actually been working on, and I'm actually showing the appointment module, which I'll explain in just a moment, to people from really all over the world who gathered in the Philippines. So the refugee clinic, which is the last corner of that triangle, this is the old clinic in the central station in Tel Aviv. It's taking care of migrants from, today mostly Eritrea, but in the past Sudan, many countries from around the world who've come to Israel and are seeking asylum. And about 2 years ago, together with Jonah Mink, who's a graduate of the program, we implemented OpenMRS. And this was to solve a whole number of problems, which I don't really need to go into today, but to help organize all the medical information and make it available for research in the future. So this is the first training when we were teaching the staff, okay, here's your new system, how do you use it? But within just a short amount of time, we identified that there were some issues, some things that OpenMRS didn't do. And no one in the community had done them yet. No one had created that bit of software. And so this was the classic Firefox situation where you needed a button to do something that didn't exist, and so we decided to create it. So I approached the Information Systems Engineering Department here at BGU and made my way to Dr. Tobin. And I said to him, well, listen, I've got OpenMRS, it's this community I've been involved with, it's a great computer science program, could you find me some students? He said, great timing. All of our students, and this is pretty typical, I knew this was pretty typical because I spent This is something that you spend a lot of time on, hundreds of hours working on these projects and creating something. Unfortunately, most of them end up being sort of academic projects that sort of end on the last day of school. No one ever sees the result of them. But my idea was to engage people so that they could take these projects and have it benefit someone or do something. And so Kobe got on board with that in a big way, and he found two students, Jonathan and Adam, and they basically received university credit for creating a new module for OpenMRS to solve the issue of scheduling appointments. It seems like a pretty basic function that we take for granted in systems that we work with on a day-to-day basis, but it didn't exist. And so they did a fantastic job with the project. It does everything you might think of an appointment scheduling system, and it has some special features that are specific for the developing world, which I won't necessarily go into, but it suited this sort of open source system that's used mainly in the global south. And they implemented it. This is their first training again with the clinic in Tel Aviv. And in that time, in the time since it was implemented, and this is now going back just over a year, there have been 6,700 appointments that we've scheduled at the clinic in Tel Aviv. The software itself has been made public in that sort of open source way, both as an executable that you can download and install on your OpenMRS, and also as source code that you could get in and change and improve. And that's been downloaded more than 350 times, I just checked today. And it's also being implemented at Partners in Health in Haiti, at their new Mirabelais hospital, the Central Plateau, and it's expected that that will be a part of taking care of their more than 100,000 patients that they plan to see each year. And it's particularly important for them, this is a particularly important feature, because they're doing a lot of chronic care, TB, HIV, and they need a way to really efficiently follow up with people. I also know that the software has been implemented, 350 downloads, maybe someone downloads it a couple of times or something, but I know for sure that people have asked for support on it in 5 other countries around the world. So back to this sort of idea, connecting a real-life clinic, somewhere that could be a test bed, to an open source software community, to students. Each one of these groups really receives something special from the interaction. They're bi-directional in terms of the relationship on all 3, and so I just thought I'd sort of mention each one. The Ben Gurion University students, of course, are getting great mentorship from OpenMRS. They can sign online at any hour of the day and get support from people in Uganda, Europe, the US. And at the same token, on the other side of the coin, OpenMRS is now getting new software developers that know the platform and are going to be experts in creating the next module after they're done here. The Ben Gurion University students also got to do something that they cared about, something that meant something to them, something they knew were going to help people, and something that they knew was going to make a lasting impact as opposed to just write some software that got thrown in the trash can. And so that was sort of this relationship now with the refugee clinic. And the refugee clinic also gave to them not only a project of a real issue that needed solving, but also gave to them the real life experience of going out and doing what we call business analysis and understanding the problem and how to translate that into a computer software that solves that problem. And then the last relationship on the bottom is a little more subtle, but it's, I think, equally important. And that's between OpenMRS and the refugee clinic itself. So the refugee clinic benefited by using OpenMRS, and that suddenly, when students move on, myself included, they have access to a global network of people who are experts in this particular software platform. And so if they have a question, day or night, they can email out on the list and say, we're having this problem, and probably within 3 or 4 hours, they'll get some kind of response. And at the same time, OpenMRS is now having yet another great clinic that's using the software and has become an active member of the community and is providing a whole group of computer nerds from around the world insight into what's actually important to build into a medical information system. And so the project is continuing. It's not just computer science students that are involved in this. Having a medical student involved was hugely important to sort of serve as that translator between, well, this is a medical clinic and this is how they function and these are the terms that they're using, to, okay, this is a computer system, it's computer engineers, and how do you find that middle ground? And so maybe there would be a medical student in the middle of this triangle or something. But the project's continuing this year. I'll just close on the final thought that this is what we're working on this year. The best I can describe it is a cross between kayak.com and Google search for a patient's chart. It basically allows you to instantaneously have access to all labs, consultation notes, or any history that's inside of the information system. You search for that, and you have all those nice little sliders like you have on Kayak, and you can narrow down from hundreds of thousands of observations on a patient down to one or two that meets your criteria within, like I said, just a second or so. So there's a lot of exciting stuff, and we're looking forward to keeping the project going with the help of Kobe over on the other side of the campus. And if anyone here is interested in getting involved, not hard to find. Thanks.